Welcome to Evergreen Family Medicine. Today we're talking about PFAC. That's the Patient and Family Advisory Council. We have Tim and Bertie in studio today to talk about what PFAC is and give you a little bit more of an idea of just another way that Evergreen is listening to the community to make their services better. Tim, thank you very much for your time today.
It's a pleasure and an honor to be here.
Welcome, and thank you for your time today, Bertie.
Thank you.
So what is PFAC?
PFAC is Patient and Family Advisory Council, being made up of patients there at Evergreen and family consisting of providers at Evergreen, so that's the family part, and advisory council. Tim and myself are advisors, and we advise where we feel changes need to be made or things that are going well. You know, it's kind of like getting a survey. What can you change? What can you do better? And we try to make it better for patients in the facility.
You know, at my age, it is really something new and, to me, on the leading edge. 30, 40 years ago, I wouldn't have thought that a medical facility would be asking patients how they can do a better job. And in this particular case, just in any number of different kinds of ways, they're asking us how things are going, what suggestions we might have, criticisms, and it's just a collaborative effort on behalf of patients and staff as well.
Give me an example of, for instance, that a provider might bring a topic to you for your input.
The issue of measles immunizations. Many patients didn't know about the outbreak, and we had a flyer that was sent to, well, given to us at our meeting, which described things about what to look for when you had measles and who should be vaccinated and who should not. And that's one thing. And then same with shingles. And there's also Evergreen talks that are provided by various providers. And so we are able to go to those and get input from that and say, hey, this would help patients, and it's a great idea.
What do you like best about being on PFAC?
At my age, as an 80-year-old, I came up with, first of all, a mission statement for myself when I turned 65. Like, what do I want to do with the rest of my life? And it came out to be to serve God, families, and community. In doing the work around seniors and what happens as we get more frail, retirement, loss of loved ones, and those kinds of things. Something else that's come to my personal forefront is the awareness of living with a purposeful life. And so doing both the work in terms of the Evergreen Council and then being on the Douglas County Senior Services Advisory Council, those are two particular areas. And then I have an avid ongoing work in terms of now almost 60 years of outdoor and scenic photography. And those just are wonderful for me. They keep me going.
Evergreen really wants feedback from the community, really wants feedback from patients and family members, obviously, because of PFAC. What do you think it says about Evergreen that this PFAC council exists?
Well, we are a community as a whole. I mean, the council. And some of us, one of the questions they asked on our original survey was what we do to volunteer in the community and how we can take those experiences and use those in our meetings to help with patients, things that they might not know. And Evergreen is always trying to go the extra mile to provide excellent care, if you will, to the patients at Evergreen. It's a great opportunity to serve the community, to serve patients, and to have our input heard by the staff at Evergreen. They take our input and they make, you know, changes for the better, and it's completely coordinated, you know.
Terrific. Thank you once again for your time.
Well, you're quite welcome. Thank you.
Thank you.
All right. You can learn more about PFAC, the Patient and Family Advisory Council, online at evergreenfamilymedicine.com. You can also follow Evergreen through social media, through Facebook, Instagram, and Twitter.